Well, concussions are very common, and they seem to be more common than we used to think they were in the past. I think concussions were kind of brushed under the rug or passed off as little bell ringers or dings. Play through it, suck it up, get back to play. We used to really minimize the effect of concussions. Now we know they're serious brain injuries that can result in lifelong problems. It's real important that coaches and athletic trainers and even parents know about the signs and symptoms of concussion. And we really want the players to know about it as well. So when they can identify they've been hit, they get headaches, dizziness, they have other problems with blurred vision, or they can't concentrate, they need to know that's a concussion. They need to know to take themselves out of play, to take a few days off of school to recover, and to slowly transition back to play after they get medical clearance and after they transition back to more exertion and know that their symptoms don't recur. The new Oregon law called Max's Law was passed in 2009. A number of us were involved with going to the legislature and helping this law get passed. The new law has three components. One is no same-day return to play if you get a concussion. You have to sit out, and the second part is you need to get a medical clearance before you can come back to play. And the third part is yearly coaches' education is required for every coach that coaches high school athletics. Once you've identified that you have concussion symptoms, it's real important to get rest. Cognitive rest, physical rest. You really need to rest for a few days, stay home from school for a couple days. If your symptoms resolve, then you can transition back into activity after medical clearance and generally get back to playing within about a week. However, if symptoms persist, more rest is warranted. Got to go see your medical provider and come up with a treatment plan that usually involves some modified school, some rest, and then transition back to activities as tolerated. I'm also the co-director of the Oregon Concussion Awareness and Management Program, OCAMP. It's a collaboration between the Oregon Department of Education, the OSAA, and a number of medical groups, and we're basically trying to put together a program that helps the student athlete transition from the field through the medical system and back to the classroom and get the help they need both from the medical side and the educational side so they can participate in athletics and be great students and not have lifelong problems from concussions.